Kawasaki disease is the most common acquired heart disease in children. When untreated, 1/4 of patients develop coronary artery aneurysms that can lead to heart attacks, congestive heart failures, or even sudden death. Pediatric symptoms, these include fever, rashes, bloodshot eyes, and redness of the mouth, throat, hands, and the feet. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about the drop in the rates of Kawasaki disease during the COVID-19 pandemic. According to the recent study that was published in the JAMA Network Open Pediatrics, the researchers found that the Kawasaki disease per se, these cases fell by 28% in 2020 and also remained low during the peak pandemic period. The drop, they said, was associated with school closures, masking mandates, decreased ambient air pollution, and also reduced circulation of respiratory viruses. This disease, in the cases, rebounded back in the spring of 2021, coinciding with the lifting of masking mandates and the return of in-person schooling. While this condition affects less than 6,000 children each year, the disease still continues to puzzle the pediatricians as its exact triggering modes and the entry into the body have not yet been identified. Unlike COVID-19, this disease is not contagious. However, the discovery that precautions against the coronavirus were effective in reducing Kawasaki disease suggests that its triggers are similarly inhaled into the upper respiratory tract. The results from the analysis showed that the rates of Kawasaki disease are typically higher in males and Asian children, and that these groups, they saw especially large drop in cases during the pandemic period. It was also mentioned that the another group, they saw a disproportionately decrease with children aged 1 through 5. This was notable when compared to the infants who saw no significant change in the Kawasaki disease rates during this particular period. The reason that they gave was less likely because infant behavior was not as significantly impacted by the pandemic, while typical activities and exposures for the older children changed more dramatically. Therefore, the authors concluded that the patterns suggested that social behavior affects the exposure to the agents that trigger the Kawasaki disease and are consistent with the respiratory portal of entry. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.